Good afternoon. I'm Tim McLean with County HSA Communications. With us today are Chairman Cox and Supervisor Fletcher and 3 county doctors. Once again, when you come to the microphone, please stick to one question and one follow-up. Speakers will hang around when the press conference is over to answer all of your one-on-one questions. Thank you.
Well, good afternoon. It certainly has been a long week for everybody, and we want to thank everyone for your cooperation and being here to assist us with this media availability. I'm still Greg Cox, Chairman of the San Diego County Board of Supervisors, and we're here to provide some ongoing media and public updates on the coronavirus. Once again, we have with us today Supervisor Nathan Fletcher, who is serving on the coronavirus subcommittee. We also have Dr. Wilma Wooten, the county's public health officer, and Dr. Eric McDonald, the director of the county's epidemiology and immunization services branch, and Dr. Nick Efantides, the chief medical officer. And we have available, if there are questions, Jack Pellegrino, who is the chief logistics officer, and Rob Sills, who's directing the Medical Operations Center. I know today a lot of you have questions, and we're going to try to provide answers as best we can. The governor's stay-at-home order was provided yesterday, and Supervisor Fletcher is going to update us on that. We'll tell you what we know about the order in terms of what it means for San Diego. I do want to urge people to please follow the order and limit non-essential travel. This is certainly a pivotal moment in regards to this virus, and we need everyone to do their part. Because this virus is evolving day by day, we are planning to hold a weekend update tomorrow afternoon at 2:30. We also have had a lot of media questions lately about the economic impact of this crisis on the county. And I want to assure you that we are tracking our spending. We know that there's going to be federal funding and state funding that will be made available to cover many of those costs, not only to the county, but to other parties that are participating in addressing this issue. We do expect those costs to add up, and we're optimistic that we're going to get the reimbursement for those costs that we are incurring. But more than anything else, I want to emphasize that the county is in a strong financial position. It's times like these that we've built up our reserves so that we can spend what we need to spend. And frankly, the cost of inaction is much more greater than the fact that we're willing to do whatever we need to do to address this problem. And I can assure you we are going to do exactly that. Finally, I want to take a moment to share with all San Diegans that they should be immensely proud of the work that is going on behind the scenes. Again, I just want to clarify, I've had some vocal cord surgery, so I have to clear my throat every once in a while. I don't have the coronavirus. As chairman of the Board of Supervisors, I've had the opportunity over the last couple of days to visit with the dedicated staff at the County Operations Center. It's really humbling to see the commitment of the literally hundreds of people that are over there doing their jobs, usually on 12-hour shifts. It's filled with people from the county, the city, and numerous representatives from the public and private sector that are all an integral part of what we are attempting to do in addressing this issue. I want to thank them for their work and their many long hours over the last days, and we know that they're going to be doing the same thing over the next few days. I also had the opportunity this morning to go out to Miramar. I appreciate the fact that Colonel Chuck Dockery led me on a tour of the facilities at Miramar, and I want to tell you what a great job the Marines are doing at Miramar. Obviously, they had the first group of people that came over from China. They did a great job in meeting their needs and getting them relocated to their homes here in the United States. And then they had the second wave of individuals from the cruise ship that was disembarked in San Francisco. The last of those people staying at Miramar will probably be released sometime next week. But I have to tell you, a big shout out for the United States Marine Corps and Marine Corps Air Station Miramar for the outstanding job that they are doing. And they've actually provided, I think, us with a lot of opportunities to see such a well-run organization, and we've adopted many of the things that they are doing. I've been on this board for 25 years, and we've been through a number of crises during those 25 years. We had the 2003, 2007 fires. I think we learned a lot of lessons over those experiences. We've had other situations with H1N1, with obviously the Hepe crisis a couple of years ago. And I think I can say with a great deal of confidence that I think this county is better prepared than we ever have been in the past to deal with the crisis of this magnitude. Now, let me also say we're not perfect. We are doing the best things we can based upon the best information that is available, and we will continue to do that. We're getting the information from the federal government, from the state government, and obviously from our medical professionals standing behind me that are doing an outstanding job in trying to make sure we give the best protection we can to the citizens of San Diego County. I also want to compliment my colleagues on the board, Supervisor Gaspar, Supervisor Desmond, Supervisor Jacob, for the great job that they are doing in their districts. And obviously, I want to commend Supervisor Fletcher for all the extra effort he's putting in with the homeless community and making sure that we address their needs in a timely manner. And with that, I would like to go ahead and call on Supervisor Fletcher to come up and give us his report.
Thank you, Supervisor Cox, and you can always count on the Marines to get it done right. With an understanding of the gravity of the situation the state of California faces, Governor Gavin Newsom issued an executive order last night directing all Californians in non-essential roles and services to remain at home. This order was given in order to protect public health, and it is rooted in the basic belief that every life has value, and as a state, the circumstances and situations we face require us to do more than we had been doing. I spoke to the governor today and conveyed that in San Diego County, we support his effort, and we will ensure that in our jurisdiction it is fully implemented and carried out. The governor's order directs all Californians to stay home except as needed for making continuity of operations of the federal critical infrastructure sectors. They provided a link and a list to those 16 sectors that are defined as essential businesses, which include sectors of chemical, commercial, communications, critical manufacturing, dams, defense, emergency services, energy, financial services, food and agricultural, government facilities, health and public health, information technology, nuclear reactors, transportation, and water. A full link to the governor's executive order and the link to these listings of these 16 sectors are available at covid19.ca.gov. The governor's executive order is an order. It is not a suggestion. It is not an encouragement. It is a legally enforceable requirement in all 58 counties in California, which of course includes us. If your business is not allowed to operate under this order, meaning you are not in one of those 16 identified sectors, then you are not allowed to operate anywhere in the state of California, including in San Diego County. If you are allowed to operate as a business in the state of California under the governor's executive order, meaning you are in one of those categories, if you are allowed to operate in the state of California, you are still subject to the San Diego requirements and public health orders that we have given. To be clear, our orders are 10 or fewer, which constitutes a mass gathering. So if you are a business that is covered by the governor's executive order and you are in San Diego County, you still cannot have more than 10 visitors or guests in your facility or location. Our order does not count the number of employees. Employees are not counted in the 10. So if you are a biotech essential business because you fit into the category of health and public health or critical manufacturing, and you have 50 employees, your 50 employees can go to work. They do have to maintain the social distancing requirements, but you could not have a meeting of visitors to your facility of 10 or more. In San Diego County, there are a few entities that are not subject to the requirement of 10. They are outlined in our orders, and common sense leads us to understand why. If you are a hospital in San Diego County, by your nature, you will have more than 10 people there. If you are a homeless shelter, by your nature, you will have more than 10 people there. If you are a grocery store, you may have more than 10 people at any one time. But those entities are expected to adhere as best they can to the social distancing requirements. We understand that in a state as large as California and a county as dynamic as San Diego's, there will be a lot of questions about the statewide order. There will be a lot of what about this or what about that. The governor indicated yesterday that he will continue to provide additional guidance. They will continue to provide additional information, and they may expand or potentially contract the list of essential services as they deem fit. We are not in a position as the County of San Diego to speculate on who is or is not covered by the governor's order. The governor's order speaks for itself. Their listings they provide speak for themselves, and questions about those are best directed to the state of California. But what is clear is the County of San Diego and the state of California want you to stay home. If you are in an essential service or essential business, we want you to adhere to social distancing practices and requirements. There are a number of things that are clear that you can do. Go to the gas station, go to the pharmacy, go to the grocery store, go to the bank. You can go outside and go for a walk. You can take your family unit who you live with in your home together and go to a field or an open park or play. You can use all the technology we have to stay connected to your loved ones and friends who are around you. It is also clear that essential businesses have to remain open because the water has to come out of our faucets. The power has to remain on in our homes. People have to eat. Our healthcare facilities have to remain open. Our transit system has to operate. Our nation's critical infrastructure has to be maintained. Our biotech industries have to continue to work on test and treatment. Our first responders have to keep you safe. Additionally, essential state and local government functions will remain open, including law enforcement and offices that provide services. It is also really clear the things that you cannot do under this order. Dine-in restaurants, bars and nightclubs, entertainment venues, gyms and fitness studios, public events and conventions. And we are asking the public to join with us in this effort. Each and every one of us is on the front lines of having the ability to stand together and fight the spread of this. Since we made our first pronouncements about this in January, we have seen a series of escalating steps that have moved in direct proportion to the escalating nature and challenges that we face. We have been proactive, we have been aggressive in our efforts to try and slow the spread. As we get increasing testing that comes online, we will see the cases that have been rising will continue to rise at a greater rate. That does not mean that the social distancing requirements are not working. The reality is, absent the social distancing requirements, absent the steps that we've been taking, the rise and spread would have been much greater and will be much greater moving forward. Bottom line, we want you to stay home unless you're an essential worker and an essential job. For those folks who have to go out, we want you to adhere to social distancing, proper hygiene, and hand washing. If you feel sick, isolate yourself at home. If you are so sick you would normally go to the hospital or the doctor, then call them, get advice and guidance on where you should go and show. And then most importantly, let us all remember that we all have the equal opportunity to tackle this challenge and this crisis in front of us. We know that it has great difficulty. We know it will have a great economic impact. We will move to ensure that no San Diegan goes hungry or loses their home, but we will do all of those things in accordance with making sure we're doing everything we can to protect the life and health and safety of San Diego residents. Thank you. Next, we'll hear from Dr. Wilma Wooten.
Good afternoon, everyone, and thank you, Supervisor Fletcher. A great deal has changed in the last 24 hours. Last evening, as has already been stated, the governor issued an executive order, which Supervisor Fletcher has stated that we are working with the state really to obtain additional guidance about what this executive order really entails. But the message is very clear. All Californians are being asked to stay at home if you do not need to go out for essential reasons. Non-essential travel includes travel that is considered to be tourism or recreational in nature. So it is safer to stay at home. We are asking all San Diegans to do your part. But I also want to thank our residents because as we have been issuing health officers' orders over the past 10 days or so, citizens, businesses, and organizations have stepped up to the plate to do their part. Now I am personally asking you to do more. Please stay at home unless you need to go out for essential reasons. So the number of COVID-19 cases has increased since yesterday, and we are now at 105 cases. Keep in mind that with more hospitals and commercial laboratories coming on board to test, we will see more tests being performed, and that means that we will have more cases. However, everyone does not need to be tested. 80%, that's 80% of individuals who get COVID-19 have mild to moderate symptoms. And these individuals can self-isolate and stay home, which means they do not need to go to the doctor unless they develop more advanced or complications. The Centers for Disease Control and Prevention, or CDC, has issued new guidelines, and individuals with mild to moderate symptoms can stay at home until their symptoms have resolved with no fever for at least 3 days without the use of antipyretic or fever medication. And, so it's a two-part, no fever within the last 3 days without the use of medication, and at least 7 days has passed since the first onset of symptoms. Lastly, yesterday, there were several questions about the supply of personal protective equipment. During this past week, our county's Medical Operations Center, or our MOC, received and fulfilled over 150 requests for resources. Our Medical Operations Center is in communications daily with the emergency managers from each of the San Diego County healthcare systems and hospitals through multiple methods. We are closely monitoring all resources within our healthcare community and ensuring these facilities, that those facilities are actively assessing and treating COVID-19 patients have the resources that they need to safely administer a high level of quality care. Now please welcome to the mic Dr. Eric McDonald, who will give demographic information about our 105 cases. Thank you.
Thank you, Dr. Wooten. There have been a total of 105 cases in San Diego County that have been reported. 89 of them have been San Diego County residents. 8 are associated with the federal quarantine, and 8 are non-county residents. If you go to our website, we've actually update that every afternoon, and we actually now have included a breakdown by age group on the website, and you'll notice that we've now reported our youngest patient, who is a 19-year-old who is actually doing well on home isolation. Of the 105 patients, 13 of them have been hospitalized. I don't have any updates on the groups that I have discussed in previous presentations to you, and no new groups have been identified. I was previously asked about the number of tests that we hear about in the county. So those 105 tests that we have that are positive, we know are of a total of 1,049 tests that have been reported to us. However, there is probably more tests that have been done that are yet to be reported to us because there is a significant delay between the time tests are taken and they're reported by commercial laboratories. I do want to give a short update on the conditions at Miramar. Supervisor Cox mentioned that he visited there today. The Marines and the county are both in a support role to the federal quarantine there, which is being led by the Health and Human Services Agency. There are various parts of the agency that are there, including disaster medical assistance teams, the Assistant Secretary for Preparedness and Response, the Centers for Disease Control, and other components who are coming together along with law enforcement from the Department of Justice, which includes DEA and the Bureau of Land Management and federal marshals. That team has come together, initially taking care of 498 individuals. They are currently down to 209 after their Operation Homeward Bound, sending people to their home states. 196 of them remain at Miramar. 4 individuals are hospitalized, and 4 are being cared for off base at a specific facility to care for individuals who are positive for COVID. I have to say that the work that those individuals are doing to get those guests from the cruise ship home has really been phenomenal to watch, and again, it's been a pleasure supporting their efforts there. I do have an update also on the cruise ship situation. As I mentioned yesterday, the Disney Wonder started disembarking patients, I say patients, it's a habit because I'm a physician, guests, and they have disembarked about half of them, and they're continuing to do that today. The total of just under 2,000 guests will be leaving the ship by the end of today, and the ship will remain actually at the port for the next several weeks. We are working together with the Centers for Disease Control Quarantine Station, the Centers for Disease Control Cruise Ship Task Force, the Coast Guard, Customs and Border Patrol, the city, and the state to accomplish these disembarkations safely. We do have one cruise ship that is scheduled to come in next week. The Celebrity Eclipse is due in on the 27th, and we are closely monitoring the conditions of the health of the individuals on that ship to make sure that they can safely disembark here. The current plan is that they will do so sometime next week. And I think that covers what I'm going to talk about. I'll give it back to Supervisor Cox.
Okay, before we go to questions, let me ask if there's any additional comments or clarifications anybody would like to make. Okay.
Good afternoon, folks. I'd just like to make one comment from the experience I had driving here today. I have never been cut off and tailgated as much today as I have been today. I understand there may be a sense of urgency in our community, but as a physician, I would like to say and have everybody keep in mind, we need to prevent the preventable so that we can be prepared to deal with the inevitable. We are still very concerned about the capacity of our healthcare delivery system. And Dr. McDonald is board certified. I've spent some of my life working in an emergency room. I can't tell you how much of what we deal in emergency rooms is completely preventable. So just a word of encouragement as a physician for our community, whether it's appropriate utilization of personal protection equipment, that's the whole reason that the hospitals are working so closely together on doing cancellations of elective surgeries.
We really need to be prepared for what we could be facing in the future. So I would just ask you all as a physician, please prevent the preventable so we can be prepared to deal with the inevitable. Thank you.
Thank you, Doctor. With that, we will go ahead and open it up to questions. Again, we would ask you to step up to the microphone, state your name and your outlet, and to please keep it to one question. If you have follow-up questions, you can come back to the mic for another bite at the apple. Go ahead and start.
Jennifer Dela Cruz, ABC 10 News. Can you confirm that there are still no deaths in San Diego County? That is correct.
That's correct.
And in response to the masks, you said there were 100, Dr. Wooten, 150 fulfillment orders placed for some resources to hospitals. We have still had doctors and nurses reaching out to us today saying that they do not have those resources. Could you dive in a little more into where they are? Have they been ordered? Have they been fulfilled? Are they actually at the hospitals to be distributed to those healthcare workers? How is that actually working?
Rob Sills, who is the directing the Medical Operations Center, will answer that question. Rob?
Absolutely, thank you. Yes, we are actively receiving requests, update through multiple venues from the emergency medical managers at each of the healthcare facilities within San Diego County, and we're turning those around. We're at same-day turnaround right now, and I don't think a day's gone by since the last week of November that I have not spoken to an emergency manager for one of our healthcare systems, and they are getting what they need. So I'm in contact with them. We're turning around the resources and providing them with the personal protective equipment that we have to receive.
If folks have concerns, how do they get in touch with you?
Yeah, I mean, if the hospitals have concerns, every one of the hospitals I deal with has an incident command center, and they have a direct pipeline to my team. So if they're not getting what they need, I need to hear about it so we can get them that. We have also sent up through the emergency resources we have at the state, we have sent up requests for additional resources so that we can keep number of days on hand for these providers that are taking care of our patients. And that is an active system that's happening. I received communication before I got here, and the pipeline is starting to open up, and we're getting receiving stuff at our warehouse. Thank you.
Okay, question over here.
Yes, Bruce Patch, News 8. At STCCU, there's a drive-up testing facility. Could you go into a little bit about who's there, whose is it, and who is coming up, and what can they expect, and how long will it be there?
That process is for individuals that are referred from a provider. It is not for the general public to just drive through, oh, I think I have COVID-19 symptoms, or I think I might need a test. That is not the process. It is a referral process from our healthcare providers so these patients don't clog up our emergency departments.
So the healthcare providers, not the county, and individuals? Like
No, healthcare
institution?
providers throughout the county of San Diego. Yes, sir. And Dr. Nick?
Yeah, just a follow-up of that because it's a very good point. Folks, currently we've got some fascinating innovations going on in our community that many health systems are doing individually. There is also a subset of our folks, as you all know, we've talked about them a lot here, the safety net individuals who may not have quote-unquote private health insurance. And there is a lot of coordination going on. Some of what is currently occurring is really very proactive efforts to have these systems in place with hopes in the not too distant future, again going back to issues that are being dealt with at a national level, that when there is further readily available testing capacities, that we will have these more mobile alternatives for the residents of our region to go to. Just want to reinforce with what Dr. Wooten said, it is so important. They are not currently designed to be drive-thrus like a food establishment. They are referral-based. In the future, as testing capacities increase, we will have a better air traffic control system and a mechanism of these facilities being used appropriately and more robustly as the testing capacity increases. Thank you.
So you're gonna get a threefer for that question, so, okay. I do really want to talk about testing for a moment, because I think it's really important that people understand this. You know, we as healthcare providers, whether it's the public health department or partners in the healthcare system and clinics, understand that individuals are very anxious about this disease, about COVID-19. People with symptoms especially, however mild, are even more anxious. And we know that for an average individual, the best way to allay that anxiety is to get a test. But it turns out it's important to know that the current availability of testing is extremely limited. And for people who have no symptoms, or for people who have mild or moderate symptoms, they don't need to be tested. The simple fact is that instructions to a person who have either no symptoms and they were exposed, have mild or moderate symptoms, but wouldn't have otherwise gone to see the doctor, the test result's not going to change what you do, because what you do is to self-isolate until your symptoms have resolved for at least 3 days. So it doesn't change what you do, and that's something that I learned in medical school as a first-year medical student. Don't order a test unless it's going to change what you do, okay? But we need to conserve those tests for those who really need it. That is, people who are hospitalized or in critical functions caring for vulnerable individuals. And because the supply is very limited now, the message that I think is most important is that people understand that if you have no mild or moderate symptoms and wouldn't otherwise be going in for health care, you really don't need to be tested. We hope that testing is easily available in the future and that we will be able to turn around so you can act upon that, but that's just not occurring at the present time. So I just want to make sure that people really understood that specific point. If you think that you might need a test, you should be talking to your medical provider. And with your medical provider, you will be able to determine whether it's medically necessary for your test to actually take place. And that then feeds into the systems that some hospitals have, the access to the commercial laboratories, or these by appointment only setups that the county and others have set up. So thank you.
Okay, I don't see any other, oh, yes, we do. Yes, go ahead, Artie.
I'm asking a few questions on behalf of our viewers who have pegged me as somebody who's here at these daily updates. So I'm asking these questions on behalf of just San Diego residents. And for a number of reasons, it's pretty clear that, testing is limited. Dr. Wooten talked about new guidelines. Yesterday, though, we heard a pretty ominous comment from Governor Newsom, who said 56% of Californians will get the coronavirus in the next 8 weeks. I'd like your opinion on that in the local context. And is there any way to, we hear this number 105 right now, that's going to go up in a couple of hours. Is there any way to guesstimate how many people here in San Diego County might actually have the coronavirus right now?
Well, I wish we could make guesses, and that would be a good way to plan things, but that's not what's going to happen. What we need to do is take the projections that have been made that were the basis of both our decisions here and the decisions by the governor to do these non-pharmacologic interventions, because those are the only tools we have necessary to bend the curve down and decrease the number of cases. I would estimate, just by our close contact investigations and individuals who are mildly ill that we don't have the capacity to test but may have been in contact, we've given them advice to self-isolate at home, that at least what we are seeing is the tip of the iceberg, and at a minimum, the number of actual cases that are probably in the community is probably 10 times what we're seeing in terms of what we're reporting. We will learn as time goes by whether that's a good estimate or a bad estimate, but we must assume that there is a significant number of lower acuity or milder cases that might be in the community, which is precisely why the governor and we have been making these recommendations to be safer at home. And if you yourself have the symptoms, you must stay at home and be self-isolated from those in your household and certainly the general public.
Okay, another question.
Thank you, Dr. McDonald. You guys have done a pretty good job of breaking down the positive cases by age group. Are we going to be at the point where we can break them down by neighborhoods and communities? A lot of people are wondering, hey, for instance, I live in Rancho Penasquitos. If there's somebody in my neighborhood who has tested positive, maybe I should know about that to take precautions.
Well, first of all, we have the 105 cases are pretty much throughout the county, and we have a widespread. So it doesn't matter where someone is, but I can tell you that on the website, as of yesterday, we did post where each of the city municipalities, where the cases are located. We are not going to drill down to lower areas because we have to worry about confidentiality. With that information, someone could have additional information and figure out who these individuals could potentially be. Usually when we give epidemiological reports, in a cell where there is 5 or less, we put an asterisk so that that information is not available where someone could possibly identify who are the people that satisfy that particular category. But we have put that information on the website, so you can go there and find that, and we will do that, update that information every Friday by close of business for the total numbers. Early on, if we had 1 or 2 cases here and there, that was not the time to put that information. But now we basically have 1 or more cases in almost every municipality. There are a couple of situations where we were not able to obtain the information, the person's zip code. So we don't know. It's about 5 cases, but you'll see that on the website. Again, I know you're fixated with the numbers, but it really doesn't matter. This virus is throughout the county. It's throughout the state. It is throughout the nation. And what's important is, how do you protect yourselves? You protect yourselves through the tried and true evidence-based strategies: washing your hands, staying home when you are sick, covering your cough even when you're home because you have family members that may not be sick and you don't want to infect them. But if we practice these strategies, we will see, and over time, that's why the stay at home, over time, we hope that if people have been exposed and they will go through the incubation period, have the symptoms, and those symptoms are resolved. If people stay at home, we decrease the risk of exposing others who are not sick. And that is the goal of this stay at home. It's safer to stay at home. That's the goal of that strategy, and all of the other social distancing strategies that are evidence-based. Thank you.
Okay, question over here.
Hi, Gary Worth, San Diego Union Tribune. Just wondering if you could say anything about compliance and about enforcement on orders about gatherings in businesses, restaurants, bars. Does it seem to be 100% compliance, and how would that be enforced? And also, somebody had asked me, a little unclear, is it applied to tennis courts and to golf courses too? I think it does, but just wanted to check.
So, we want people to understand, in terms of enforcement, we can't be everywhere. But as I said in my opening comments, organizations, individuals, and businesses have been very supportive of the orders that have been issued. And I think Dr. McDonald has said this in the past: if we can get 80 to 90% of the people to comply with the orders, we consider that a success. If other issues are reported to us, we will certainly investigate those issues that is not in compliance with the orders that we issued. In terms of a tennis court, that's physical activity. And if there are not a lot of people there, if you want to go out on a tennis court by yourself, that's just like walking your dog. You're out by yourselves. We're not saying that people can't do things that are physically, mentally, and nutrition, things that they would do for nutrition purposes, like going to the grocery store. There are certain things that are essential. So we want people to continue to do that, but adhere to the social distancing strategies that we have recommended. And I know that, no, okay. Anybody else want to? Dr. McDonald.
Yeah, I just want to make a quick comment because, I haven't used the phrase that if 80–90% of people do what we request, that that would be okay. I'll just say that I was not right. Really, we need to have 100% of people do it because it is important during this period of time that we really adhere to these non-pharmacologic interventions, and we really want everyone to do it, with the exception of the essential services that we talked about. It is really very important. We need to look at each other, support each other, to protect the least able to protect themselves in our community. So really, we're aiming for 100%, and we would expect, frankly, that San Diegans can do that to the best of their ability. So I do want to emphasize that and just correct myself, frankly. The President's strategy of 15 days to approach this problem is actually a very good way to think about this. It happens to be the incubation period of this disease, and if we do these things during this time, we will affect the number of individuals who are exposed to and come down with COVID-19. We will also allow ourselves to have significant amounts of time to prepare even more than we have already prepared to be able to make sure that tests are available and that test results are quickly available to people who need them, and to have supplies that are not just in the chain but actually in the warehouse at the locations where we need them. So this is a critical time for these next 15 days, and I just want everyone to get that message.
Okay, question over here.
Hi, Paul Sisson with the Union Tribune. I've been trying this week to get some numbers locally on the number of ventilators that we have in San Diego County. We reached out to the California Department of Public Health. They say that we have 7,500 in the state, but I can't seem to figure out how many are here in San Diego County. I call individual hospitals. They say to talk to the county. The county hasn't responded to my request. Can you tell me how many ventilators? And if you can't, are you concerned we don't have enough? Is that why we're not hearing this number?
No, and that's one of the metrics that we are tracking. We're tracking the number of available ICU beds. We're tracking the number of available ventilators in each system. And we're just looking at and we're projecting how many do we need, how many more do we need, so I can make projections up to the state in case we see that there's a spike and there are more needed. I can tell you right now we have well over 300 ventilators right now available for use. That number changes depending on the patients that need them. Again, right now, we're good. We're projecting forward so that we can be as best prepared as possible.
Follow-up question. What's the maximum number of ventilators that you're prepared to deploy in an emergency?
Yeah, thank you. And Paul, I'm going to answer your question, but it brings up something that we've talked about before. We're not new at this. We have our regional capacity plan, and we already have that activated, and we are tracking a host of available data at all levels, including what Rob just referred to, which is the number of currently available ventilators, meaning there are some ventilators that are currently being used for non-COVID related reasons. If I may, I will, in the spirit of transparency, and I've discussed this with HASDAC, put out there some general numbers in terms of, and HASDAC is the Hospital Association of San Diego and Imperial County. We have close to 8,500 total beds in our region. The number of intensive care units is actually a little bit in flux because in a posture of preparation for the surge, there is enhanced capacity of those going on, but I can tell you that in the civilian realm, don't forget we have a couple military hospitals, we have close to 600 intensive care facility rooms available. And in terms of the number of ventilators, we still have and this is a total versus available, We have just over 800 of them, but there are a couple of our military installations that we are still gathering information from. The message here is that we, in as intimate of a collaborative partnership that I could ever imagine with our regional healthcare delivery system, are seamlessly sharing this information, enhancing the capacity, and monitoring things on a daily basis with literally dozens of data points. And all the data points to this day are very positive in terms of our capacity. There are absolutely no concerns, but what we are doing is that posture of preparation to make sure, having learned through experiences in other parts of the world and in other parts of our country, that we are as prepared as possible.
Okay, we have one final question over here.
I'm Marilyn Moore with Fox 5 News. Dr. McDonald, I know you mentioned there have been 1,049 tests that have been reported back to you. I'm wondering if this is the amount of tests that have been administered total in the county that you're aware of, and how many test kits are on hand for future use?
Well, that's a great question. Again, the answer is we're not sure because some of these laboratories are not in the county and they report back to us, and so that's the first issue. We are not counting tests that are being performed by laboratories in the county that have not been validated by the public health lab. We actually have a procedure in which we get test results from local hospitals and from other entities, and be sure that the first 5 positive and negative tests are in fact correct compared to ours, and then those laboratories are, quote, on their own. And we do know that both the UCSD and Scripps laboratories locally are on their own, doing their own independent testing. We're currently working with Rady Children's Hospital on the same procedures to validate them. So I don't have an exact number for you. I mean, that is the issue. I do know that there's a delay in tests coming in, so tests that may have been done by a commercial laboratory even 4 or 5 days ago, I wouldn't know about them until the results come in. And I answered half your question, but what was the other half? You gotta remind me.
If you have an idea of how many tests there are available for future use?
Well, again, that's a great question about test availability, and I sort of hate to make this a long answer, but people think about this as a kit, okay? It's just one thing that you need in order to do a test. But actually, to do a test for COVID, it's a chain of events, each step of which requires personnel and supplies. So at the beginning, you actually have to get a swab and put it into viral transport media, okay? And those are 2 items which may or may not be in good supply at any one place. That then needs to go to a laboratory, and that laboratory has to have a machine that has a kit that allows us to run that test. So when people talk about kits at the national level, it's that portion of what the machine uses that allows us to do the test. But you need other things. You need the machine itself, which has a limited run capacity, the number of tests it can perform. You need reagents, things that are used with the kit in order to make the machine run. Those are in extremely short supply throughout the country. And you need staff who actually know how to do the extractions of the test, put it into the machine, and run it. And the numbers of people who need to be trained to do that are limited, and they need to be brought on board and trained. So each of those steps, I think you can see, has the possibility for a shortfall. And it leads to the problem that when somebody gets a test here and a result here, every part has to be aligned. And I will tell you that we're working on every part as we speak. So when we talk about kits, that's really a misnomer, that's the word I'm looking for, or a misconception. It's really, you have to have every single piece. And maybe I went into too much detail, but really every single part has to be aligned in order for a testing system to be able to get a result to a patient.
Okay, I think we're going to go ahead and cut the questions off at this point. If you have additional questions, you can do that one-on-one. Just a couple of closing comments. Yesterday, I wanted to correct something that I said in regards to the libraries. The county libraries are all closed, and the book drops, if you have a book that's due back just hold on to it. You're not going to be charged any fines, but as we get back into a normal routine, we will accept your book fine-free. A couple of observations. We've heard speakers today talk about going out on essential trips, which if you need to go to the doctor's office or if you need to go to the drugstore or the grocery store, those are all essential trips. We've talked about essential workers or essential jobs, and those are the people that are going to be staffing the stores and certainly your medical facilities and drugstores. But I want to make one thing perfectly clear. Every citizen in San Diego County has an essential role, and that is to realize that we are all in this together, that we are going to get through it, but we're going to need everybody's cooperation to do the types of things that have been talked about by my colleagues standing behind me. If you're sick, stay home. If you feel healthy, you can go outside, you can exercise, you can jog, you can fly a kite. Yesterday was the first day of spring, so it's, hopefully the weather is going to be a little more accommodating. But we want you to keep that 6-foot distance between each other. We want you to stay together as family units. We want you to realize that, now is not the time for panic. Certainly we're all concerned, but we need to be calm and we need to be smart. We can get through this a lot quicker if we can get everybody's cooperation in regards to following the simple rules that have been laid out here by my colleagues. And we sincerely hope that everyone will abide by that. If you have additional questions, we will go ahead and deal with those one-on-one. We will have a media briefing tomorrow at 2:30. Thank you very much.